Therapeutics in ENT by P L Dhingra. Ear. How to use eardrops. Eardrops are often used for treatment of external and middle ear diseases. They may be antibiotics, steroids, or antifungal drops, or those used to dissolve wax before its removal. Steps: wash your hands with soap and water or use a sanitizer. Keep a tissue paper or small gauze piece ready to wipe any excess of drops that flows out. Patient lies in supine position with face turned to the opposite side so that the affected ear is up, or the patient lies on his or her side. It can also be done with patient sitting and head tilted to opposite side. Pull the pinna upward and backwards in adults and back and a little down in children to make the canal straight. Three or four drops are instilled with a dropper. The dropper may be separate or inbuilt with eardrop bottle. Apply gentle, intermittent pressure on tragus so that drops go down the canal. Wipe excess fluid. Patient lies in this position for 5 minutes. Now leave a small cotton ball in the ear. To put drops in the other ear, same procedure is repeated after an interval of 15 to 20 minutes. Please note that some cases of middle ear disease, when tympanic membrane is perforated, may complain of discomfort in the ear. It is due to irritation of middle ear mucosa by the drops, or the drops may reach the throat, causing bad taste. In such cases, medicated wick is used so that drops do not reach the middle ear through the perforation. Take care of the sterility of the dropper and its cap. Drops should preferably be at body temperature. Too cold drops cause discomfort. Ear canal should be reasonably cleaned if the discharge before putting drops. Discharge can be cleaned by dry mopping with cotton buds. How to use eardrops in an infant or a child. The mother has to hold the infant or a young child on her lap and restrain the head. Some other person has to put the drops following the above procedure. To mop the discharge, the author has found the following procedure useful. Prepare a tapering strip of cotton ball. Make it wet with boiled water or normal sterile saline. Squeeze it between the fingers to drain out water and to make it stiff and straight, and then place it in the ear canal. It will soak the discharge. Dry cotton, even if absorbent, does not mop the discharge well. The tapering end of cotton ball can be made long to go deep in the canal. The other steps are same as in adults. Some useful therapeutic agents: 5% acetic acid. It helps to eradicate recalcitrant infections of the ear canal, especially those with pseudomonas. Acetic acid changes the pH to acidic. 2% salicylic acid. It has been used with success to treat automycosis. Salicylic acid is keratolytic. It sheds off fungal mycelia growing into skin epithelium. Alcohol is a dehydrating agent and prevents moisture. 10% ichthymol glycerin pack. It is useful in furuncle of external canal. Ichthymol is an antiseptic and glycerin is a hydroscopic, and the pack with gauze provides splintage so as to cut down movement of canal and give relief. 8% aluminum acetate pack. It is useful to stop oozing in acute diffuse otitis externa. Instead, 3% silver nitrate is equally effective. Hydrogen peroxide. 5 to 10 drops of hydrogen peroxide, 10 volumes, can be instilled into the ear canal for 2 to 3 minutes to soften the haft wax. Trichloroacetic acid. It is used to cauterize ear granulations. Use a very small pledget of cotton wool. It can be used to cauterize edge of chronic tympanic membrane perforation for closure. Silver nitrate crystals. It is used for cauterization of granulation tissue. Crystals can be fused on a silver probe, which has been heated and then dipped in crystals to form a bead. It has also been used to control epistaxis from bleeding vessel on little's area. Excess silver nitrate is neutralized by application of normal saline. Repeated applications can cause septal perforation. Phenol. The phenol can be used to cauterize mastoid granulations or edges of a tympanic membrane perforation like trichloroacetic acid. Use a pledget of cotton on Jobson horn probe. In the latter case, take precautions that the pledget does not touch the middle ear mucosa. BIP. It is a paste made by mixing bismuth subnitrate and iodoform with liquid paraffin. Ribbon gauze soaked with this paste is kept in the mastoid cavity. It helps to heal large cavities and earlier epithelialization and prevents smell in infected cavity. The patch can be kept for 6 to 7 days. Iodoform is antiseptic. Ask for any allergy to iodine before using BIP. Use of earwigs. Medicated earwigs are used for the otitis externa. They are useful in providing prolonged contact of medicine. The tropical medicine is also prevented by reaching the middle ear if the tympanic membrane is perforated. In cases of diffuse or circumscribed otitis externa, a wig provides splintage to ear canal and avoids discomfort. These days, earwigs made of myrocil are also available. Nose. Topical medication for nose. It is important to remember that most of nasal mucosa covering the turbinates and nasal cavity lies in the lateral wall, and so there is the osteomeatal complex which drains maxillary, frontal, and ethmoidal sinus. When decongesting the nasal mucosa, drops must reach this area. The same applies when using nasal sprays for allergy, rhinosinusitis, and nasal polypi. How to use nasal drops? Decongestant drops, such as that of oxymetazoline or xylometazoline, are commonly used. The steps include the patient should blow the nose gently to clear any secretions or discharge. Proper technique is important as hard blowing of nose can cause bleeding. The patient is put preferably on a bed with pillow under the shoulder and head tilted backwards and slightly to the side of the nose where drops are intended to be put. Put 3 to 5 drops into the nostrils while holding the breath. Gently stiff up and so that drops spread over the mucosa. Stay in this position for a period of 2 to 3 minutes. Wipe the excess drops while assuming normal position. Repeat the procedure on the other side. Store the bottle with its cap in back in position. Important, nasal drops cause rebound phenomenon leading to medicamentosa. Do not use it for more than 10 days. Do not use anyone else's drops and do not let any other person to use your drops to avoid cross infection from the nasal vestibule. Alternative position to instill nasal drops. Mecca position. The person kneels and bends the head. This makes the upper and ethmoid area dependent and drops reach this by gravity. This position is found to be a little uncomfortable. Putting drops in sitting position. Make the patient sit in a chair with head extended and slightly tilted to the side where drops are to be put. Put drops in the uppermost and lateral part of the nose. Gently sniff up and down so that drops spread over the entire area. Make the head straight after a few minutes and wipe the excess of drops. Putting the drops straight back would cause them to reach the nasopharynx and bad taste. It will also not decongested intended nasal mucosa. Nasal drops in children. Steps. Lay the baby or young child on its back, or the mother can hold the baby in her lap on the thigh. Extend the neck. Put 3 to 4 drops in each nostrils. Keep the baby in that position for a minute and straighten the head and make the baby upright. Wipe the nose. Remember that nasal drops for children are half the strength of that used for adults. In young babies, normal saline drops or sprays are useful to clear the nose of its secretions and make it patent. Medicated drops may not be required. Nasal sprays. A nasal spray may contain decongestant, example oxymetazoline or and an antihistamine, acetylstin, or a steroid, example fluticasone, mometasone, or simple normal saline. How to use: blow the nose gently to clear off any discharge or secretions. Remove the cap of the spray bottle and shake it. Hold the bottle in such a way that the thumb is on the bottom and the index and middle fingers on the shoulder of the bottle. Sit upright, put the nozzle of the bottle in the nostril and pump the spray and while breathing gently. The opposite nostril may be closed with the finger. Use one or two sprays as advised by a doctor. Each spray delivers a fixed amount of medication. Prolonged use of nasal sprays can cause drying, irritation, and sometimes epistaxis. Alternative method of using nasal spray. Some advise using right hand to spray in the left nostril and left hand for the right nostril. Spray is directed towards outer end of eye. This way the drug reaches the greater part of nasal mucosa on its lateral wall and towards the osteomeatal complex. Nasal irrigations or nose wash. Nasal irrigation can be done with normal or hypertonic saline. It uses a collapsible plastic bottle or a neti pot, which is similar to a neti pot with a snout which is made to snugly fit the nostril. It is often used in yoga. It can be done with the patient in a sitting or standing position. Procedure: the patient stands near a wash basin with head tilted slightly the opposite side, keeping the nostril to be used. Nozzle of the bottle is put in the nostril and fluid made to run through the nose by squeezing the plastic bottle or pressing the bulb of Higginson's syringe. The fluid will come out of the other nostril. The patient must hold breath to avoid water reaching the throat. The same procedure is repeated on the other side. After nasal wash, patient blows each nostril to remove any water left in the nose or sinuses. Uses: nasal washes removes discharge and secretion from the nose. The mucus blocking the metastasis is liquefied and drained. It removes allergens, chemicals, and dust particles. Thus, it is useful in cases of nasal allergy and in occupations involving dust and chemicals. It is useful in smokers to clean the nose of any black soot. It has been observed that normal or hypertonic saline relieves symptoms and improves endoscopic findings of chronic rhinosinusitis. It is useful in postoperative care of patients who have undergone functional endoscopic sinus surgery (FES). It is found useful in cases of Uzena, atrophic rhinitis, and other crust forming diseases to soften and wash out crusts and debris and pathologic bacteria. Gelnity nasal wash has been one of the daily practices of Shaktkarmas in yoga practice in India. It improves patency of nasal passages and keeps nose clean of allergens and particulate matter of dusty environment. People working in smoky environment or chemical industries can keep the nose clean by doing jalniti. Post-operative antral irrigation. In the days of intranasal antrostomies and cattle operation where an intranasal inferior antrostomy was done in chronic sinusitis, it was a part of home care after nasal surgery. Patients put the curved cannula in the sinus cavity and washed it with normal saline with Higginson's syringe. Now, nasal irrigation is sometimes need in post-operative care after FES. Cannula can be passed through middle meatal antrostomy and washed. Some useful therapeutic agents 25% glucose glycerin. It is prepared by mixing 25 gram of dextrose with 75 gram of glycerin. For smaller quantities, mix 10 gram of glucose in 30 gram of glycerin. It is used as a pack in ozena or atrophic rhinitis for removal of crusts. Steps: keep a pack of ribbon gauze soaked with the solution in the nasal cavity for 30 to 45 minutes on both sides. Remove the pack and douche the nasal cavity first one on one and then other side with warm saline or by mixing 1 teaspoonful common salt in 500 mg of boiled and cooled water. Blow the nose one nostril at a time to clear the nose of crusts and discharge. Maggot oil, turpentine oil 30 ml, chloroform 30 ml, gum acacia half spoon, water to make 500 ml. Douche the nasal cavity with Higson's syringe while the patient is in sitting position. As the maggots come out, they are picked up with a forceps. The oil can be used when any other wound is infected with maggots. Do not use it in infected tracheostomy wounds. Turpentine oil is irrigated to nasal cavities, only chloroform water can be used. Alkaline nasal douching. Sodium bicarbonate 30 gram, sodium biborate 30 gram, sodium chloride 60 gram. Mix it into a powder. Dissolve 1 teaspoon in 280 ml of warm boiled water and irrigate the nasal cavities. Povidone iodine ointment. It can be used in nasal vestibule to clear it of cephalococcal infection. It can be applied with the tip of a finger 2 to 3 times a day. Mupirocin ointment. It is useful to eradicate methicillin resistant Staphylococcus aureus MRSA from nasal vestibule. Tincture benzoin co. Tincture benzoin compound. It has been used for inhalation to relief in laryngitis. It is also used as an adhesive after stitch removal. A very thin layer of cotton wool is spread over the stitch line and tincture applied with cotton bud. Thank you.